The liver is one of the most crucial human body parts. The liver plays an essential role in cleaning the blood from toxins and unwanted elements. The liver works all around the clock without you even noticing. However, at times, the liver may develop problems that can result in different complications. Fatty liver syndrome is among the many complications that can develop due to problems occurring in the liver. Fatty liver is the presence of fat deposits on the liver. This hinders the liver from working as efficiently as it should, thus causing a range of symptoms. Fatty liver syndrome is a problem, but a manageable one, if one chooses to be mindful of their health choices and lifestyle. However, this can prove to be life-threatening when the problem is in the advanced stage. Here are some signs and symptoms of fatty liver disease. Presence of high cholesterol. High cholesterol is one symptom of the accumulation of fat on your liver. Usually, when you measure cholesterol in your blood, you are simply measuring what is coming out of your liver. This is because the liver is responsible for producing cholesterol and circulating it in the bloodstream. However, if you consume highly saturated foods with trans fats, more cholesterol is released into the body. This will increase cholesterol levels. Therefore, it is important to check your cholesterol levels frequently, so that you ensure the levels are maintained in a normal range. Obesity. A larger belly than usual is an indicator of fatty liver syndrome. Obesity does not necessarily mean that one has fatty liver syndrome, but having this condition can encourage weight gain. This is because when you suffer from fatty liver syndrome, your liver is not working as it should. The liver helps to filter blood, so if it is not working as it should, your blood quality will be lower. As a result, you tend to eat more food to compensate for the low blood quality. Obesity is caused by various things, but seek medical attention to ascertain the cause of obesity. Whether it is fatty liver syndrome or other causes, it is still recommended to know what is happening with your health. Family history. Sometimes, you can suffer fatty liver syndrome because a family member has suffered the same in the past. A study by Dr. Loomba and colleagues showed that families who have a history of cirrhosis have a higher risk of suffering from the same affliction. Fatigue. Fatty liver syndrome rarely has outward physical symptoms. Many people unknowingly suffer from fatty liver syndrome, making it almost impossible to identify unless you conduct a blood test. Nevertheless, once the disease reaches an advanced stage, you can come across some common symptoms like body weakness and tiredness. These symptoms are permanent and could lead to other serious diseases such as cancer. It is advisable to see a doctor if you suspect that you are developing fatty liver signs. Binge eating. Lack of enough exercise and excessive eating are some of the factors that cause obesity. The amount of food consumed can be steady, but binge eating is indicative of fatty liver syndrome. People suffering from this syndrome will find themselves feeling hungry almost all the time and crave foods with high sugars. The best thing to do is monitor the number of calories you eat. Dark urine. The liver's main function in our bodies is to filter toxins and other unwanted components from the body system. When you suffer from fatty liver syndrome, your liver is inhibited from performing this function effectively, hence fewer toxins are filtered while the rest remain in the bloodstream. These toxins are filtered into the urine from the body. The presence of a lot of toxins in your urine makes it darker. Sometimes, you will feel pain when urinating, and above all, the urine you pass produces a strong odor. If you happen to see these symptoms, you need to see a doctor. Pain in the abdomen. Abdominal pain strongly indicates a liver disease, as well as fatty liver syndrome. Usually, the pain is felt in the right upper part of the abdomen. The pain results from bleeding that occurs in the liver. You may feel like vomiting, and you may observe the presence of blood in your vomit or stool. It is therefore recommended that you see a doctor once you see these signs. These are some of the signs and symptoms of a person with fatty liver disease. If you are experiencing fatty liver disease, or you believe you may be at risk for developing fatty liver disease, you should seek out medical attention from your doctor as soon as possible. If you enjoyed this video, don't forget to like, subscribe, and be sure to turn on the bell notification so you don't miss any new videos. Also share this video with a friend who might enjoy it. And don't forget to check out the link and description below. As always friends, we wish you great wellness and happiness.